I'm speaking on this point a little bit both as a researcher who focuses on both rural populations and populations that have been made vulnerable through a variety of factors. It's really been, very well documented that the ability to protect yourself in this pandemic has really functioned on a gradient of economic elitism, and that there have been incredible racial and ethnic disparities in the US, and then also many disparities abroad too. So the test to be accessible universally, there have to be kind of support and follow up. There has to be a low enough price for different communities to buy it. It has to be geographically available, whether you live in an urban or rural area. Location matters. Can you go to a community center? Can you go to a hospital? Can you do it at home? The ability to have agency is really important here, particularly with having to reach and support some of the communities that have been hardest hit. On a personal level, I know people that are essential workers, non-medical essential workers, that this entire pandemic haven't even had access to one type of test. And so they're going into work often blind despite doing their best to mask and social distance. The other reason, though, that testing can sometimes be a difficult decision for a worker to make, if that a positive might indicate that they have to go home without support, without pay, that can be economically devastating for a whole host of people. So when we talk about access to frequent and low-cost rapid test, that piece, that equity piece of providing support, of understanding the different needs of different populations, of really reaching out is a key part of this.
Hi everyone, my name is Brianna. I'm a research assistant here at Simmons University in Boston. I'm just going to touch on that last point just a little bit. So even those who are able to get a COVID test, either it's a positive COVID test or you've had a positive COVID exposure, many of these people are not able to isolate. So I have seen this firsthand working at the Dimick Center in Boston. And this is a community health organization that works primarily with low and middle income families in the Boston area. And I help connect them with various resources. And when I'm speaking with these families over the phone, when it's regarding COVID, they have to make the decision between paying utility bills, feeding their families, paying rent, and also balancing that with keeping their coworkers safe. So it's really not just a simple yes or no answer for them. And so what we need to do is support them in their self-isolation, providing resources for those in low and middle income communities to do what is best for the health of them, their families, and their coworkers.